Hey everybody, this is Dr. Kadisha, your board certified emergency medicine physician, concierge physician, and author of the best-selling book, Help Us Help You in the Emergency Room. A little greasy. Okay, and I'm here with a coronavirus update. So, a bunch of people have been asking me about buying masks or sneaking masks out of my ER and mailing them to them. And I'm so glad that our Surgeon General, Dr. Jerome Adams, has said, people, stop buying these masks. Even the N95 respirators are not going to be 100% effective in protecting you against the coronavirus. Now, I will be honest and say that should you touch an infected surface, infected with any virus, and you touch your mouth and nose, yes, having a mask there will protect you that way. But he is saying that if you are healthy, you will not need a mask. And actually, 8 out of 10 people who catch the coronavirus, if you are healthy, will only have mild symptoms similar to those of the flu, which would be a fever, cough, and shortness of breath. And most likely you will recover. People who've gotten the coronavirus are already recovering. Even in China, they were saying that the mortality rate is 1.4%. Okay, and here, while we have about 71 cases nationwide from Washington State to Santa Clara, California, to Cook County, Illinois. Again, 80% of people, 8 out of 10, are expected to recover. Now, the person who passed away from the coronavirus in Washington State, yes, he was a 50-year-old man, but he had underlying medical issues. And it is people who are at the extremes of age and those who have underlying medical issues. Those are the people who are most likely to suffer complications of the coronavirus and suffer a more severe course of illness from the coronavirus. Meanwhile, the flu has killed 18,000 people this season. So still, the flu is killing more people than the coronavirus, as it does every year. And I urge you to get vaccinated against the flu. It's still not too late. It's only March, and the season will definitely continue at the least through March. And people are spreading viral illnesses by respiratory droplets. If someone sneezes or coughs, people within 6 feet of them are at risk of catching the virus. Yes, the flu has Tamiflu and ribavirin medications that can help shorten the duration and lessen the severity of the symptoms, but that's about it. That's about it. And it has its own complications. Hey, Carla. Hey, Patrick. Thanks for joining me. Thanks for coming in. So we were just talking about the coronavirus, just giving folks an update. And I was saying that there's still only been one death in the U.S. and that was a 50-year-old gentleman who had underlying health problems. There were 2 people at a long-term care facility in Washington State that caught it. And I think recently a high school student was reported to have caught the coronavirus through community spread in Washington State, but they are in stable condition. There has been a case in Santa Clara, California, and in Cook County, Illinois. Those people are being monitored. There have been 71 cases nationwide, but 8 out of 10 people are expected to have a mild course of the illness, similar to the flu, fever, cough, shortness of breath. And our Surgeon General is saying, people, please stop buying the face masks. Even the N95 respirators are not guaranteed to prevent you from getting the coronavirus. Yes, again, if you touch an infected surface and you touch your mouth or nose, yes, having a mask will help, but the regular procedural masks that have the gap on the side, things can still get in that way. And as far as with the N95 respirators, there's a shortage of those. companies are starting to price gouge because of the shortage. Meanwhile, health professionals who really need it to care for patients may experience a shortage. And it's not just to protect us, it's also to protect immune compromised patients in the hospital. That could be cancer patients, patients with illnesses that cause immune compromise. We've got to be able to protect those patients while we care for them and protect ourselves as we are exposed to people with viral illnesses one after the other all day long. And again, the flu has killed 18,000 people this season so far. Okay, 125 children have passed away from the flu this season, and 32 million people have been infected from the flu. So we still need to worry more about the flu. People, stop being afraid to get the flu vaccine. I've gotten the flu vaccine. Actually, Carla and I, Dr. Mosby and I have been getting the flu vaccine ever since for the past 20 years. And I've not had any untoward effects from getting the flu vaccine. So guys, please stop hoarding masks, buying masks, things like that. Your Surgeon General is saying you don't need it if you are healthy. Still, be more concerned about the flu. Get vaccinated. The Surgeon General says protect yourself from the coronavirus by washing your hands and not touching your mouth or nose when touching infected surfaces. And if you are ill, stay home. Again, this is Dr. Kadisha, your board-certified emergency medicine physician and author of the book, Help Us Help You in the Emergency Room. It's what an ER doctor would tell you if she only had the time. And follow me on Instagram and Twitter in addition to Facebook. And check out my website. And that's all at Dr. Kadisha MD. That's DrKadisha MD. Wash your hands, cover sneezes and coughs. If you're sick, stay home and stay clear at least 6 feet of someone who is sneezing and coughing. And please be safe. Have a great week. Happy Women's History Month.